Hi, my name is Tristan. I'm the ICPCU manager here at Grand Island Regional Medical Center. May is Critical Care Awareness and Recognition Month, and we are making this video to showcase some of our nurses. One of the reasons I like leading in the ICU is the interdisciplinary approach to all our patients. We work with respiratory therapy and all the departments in the hospital to watch our patients get better, and teamwork is one of the reasons I got into leading.
Hi, my name's Matt. ICU nurse here at Grand Island Regional. I love being an ICU nurse when you're able to take a patient that is just critically ill and you're able to see good results and somebody walk out and be with their family that otherwise wouldn't. There's no better feeling in the world than that.
Hi, my name is Keely Weiss. I'm a student nurse tech here at Grand Island Regional, and something that I really enjoy about this place is that every single day I am pushed to learn and to grow, and I think in my future career it'll make me a better future nurse.
Hey, my name is Stacy Peterson. I'm an RN at Grand Island Regional in the ICU. I enjoy being a nurse, in the ICU, seeing the sick patients and then seeing them get better and then eventually leaving the hospital and walking out of here. So it makes our job rewarding.
Hi, my name is Taylor. I'm a critical care nurse in the ICU at Grand Island Regional. What I like about the ICU is getting to dig deeper into a patient's background and history and get to put together pieces of a puzzle as to why they're sick and why they need intensive care.
Hi, my name is Callie Goretzky and I'm an ICU RN at Grand Island Regional. I enjoy working in the ICU because of the wide range of diagnoses that we get to treat, and I enjoy seeing some of our sickest patients get better.
My name is Devin. I'm a PCU nurse, and the reason I like working in critical care is because I like being on the journey with patients from the beginning of their hospitalization and with them through the end of it, seeing them get better, being with their families on it. I like the diversity of the patients. I like the diversity of the different specialties that I get to work with, my different coworkers, and critical care is something that is dear to my heart. I have lots of family members that have been hospitalized in this hospital, and the staff here is unmatched.
Hi, my name is Shannon. I'm a nurse on the ICU PCU unit. I love how rewarding it is to work in the critical care unit. You see the sickest of the sick and you make them better, or you help the family during the end of life.
Well, I'm Nita. I work out at Grand Island Regional Medical Center. I'm a registered respiratory therapist, and what I like about working in critical care over here is every day is something different. You never have like this same thing day after day. And it's always something to figure out, and then the best part is when you figure it out and they get better.
Hi, I'm Megan Carpenter. I'm a registered nurse on ICU at Grand Island Regional, and I like critical care because I like to have a lower patient ratio and you're really able to dig into the patient's history and help fix them.
Hi, my name is Summer and I'm a speech pathologist here at Grand Island Regional. What I like working about in critical care is the ability to address our patients' acute needs. Working alongside the nursing staff here in the ICU PCU units, I'm able to address all of our patients' needs, whether it be dysphagia, aphasia, anything that may impact them post-stroke, or any other needs that they may have. It's really wonderful to be able to work on interdisciplinary teams and to be able to help facilitate the best outcomes for our patients here at Grand Island Regional.
Hi, I'm April Harris. I'm a nurse in the ICU at Grand Island Regional Medical Center. I enjoy working in the ICU because I like to see the direct impact I can have on patients' lives.
Hello, my name is Ashley. I'm an ICU nurse here at Grand Island Regional. I love being an ICU nurse because I like to care for the patients and sometimes what can be the worst days of their lives. The other part is looking at the picture as a whole, not just taking care of the patient, but making sure that the families are what are taken care of also, combined with the teamwork and the positivity of this unit makes my job very enjoyable.
Okay, my name is Jillian Ricardo. I'm a patient care technician in ICU, Grand Island Regional. What I like the most about my work is making the patient's time in the hospital the best. Just take care of them, give them a smile, and I think that's what I like the most.
Hi, my name is Jen. I'm the wound ostomy continence nurse here at Grand Island Regional, and I enjoy working in ICU and PCU because we have so many patients come in with multiple comorbidities, and we're able to send them home healthier and happier than when they came, in addition to the great camaraderie we have with the families.
Hey, I'm Mitchell Thompson, physical therapist and rehab coordinator here. One thing that I value a ton here at Grand Island Regional is that we are able to meet our patients wherever they're at. So even in the setting where we have people that are the sickest of the sick, we're still able to mobilize them and give them the wonderful benefits of exercise and mobility even when they're at their most challenged.
Hi, my name is Jacques. I'm a respiratory therapist. I work here at Grand Island Regional Medical Center. I work in the ICU, and what I love about ICU is helping people, getting them off of ventilators, rehabilitation.
My name's Tiffany, and I'm a patient care tech on ICU PCU.
My name's Alyssa. I'm a patient care tech on ICU PCU.
And I enjoy being a PCT on ICU just to get all of the different experiences with different patients.
I'd second that, and finding my best friends.
Hi, I'm Tara Legal, and I like critical care because I like dealing with medically complex situations and helping people feel better in those situations, whether it's getting them out of here better or taking care of needs on the other way.
Okay. My name is Dr. Mitch Herbert. I'm an internist here at Grand Island Regional, and I enjoy working in critical care because of the challenge on a day-to-day basis. I like to see the sickest of the sick patients and watch them improve slowly over a number of days. It's rewarding intellectually, but also with the patient care aspect.
Hi, I'm Dr. Maniraj Naupane. I'm a pulmonary and critical care physician at Grand Island Regional Medical Center. So 2 years ago, I was critically ill and was in the ICU, and I received a second chance in my life. And I'm grateful for the excellent care of critical care physicians who took care of me. And that is what I try to replicate each day, and I try to give my patients a chance while I'm personally living a second life. So I enjoy critical care and take care of my patients wholeheartedly and try to give my best so that every patient gets that chance to live again.